Hello and welcome to my channel. In this video we will be looking at the cognitive treatments of depression, which you need to know for AQA A-level psychology in the subtopic of psychopathology. I hope you enjoy this video and find it helpful. Let's get started. Cognitive behavioral therapy, CBT, aims to identify, challenge, modify and change negative schemas and irrational, dysfunctional and maladaptive thoughts and behaviors, in order to replace them with positive, realistic, logical and rational thoughts and behaviors that are more helpful and accurate and therefore alleviate depression and improve mental health and well-being. It is a combination of cognitive therapy, a way of changing thoughts and beliefs, and behavioral therapy, a way of changing behavior in response to these thoughts and beliefs. There are various components to CBT, including initial assessment, goal setting, and identifying negative and irrational thoughts and challenging these either using Beck's cognitive therapy or Ellis's REBT therapy. All CBT starts with an initial assessment, in which the patient and therapist identify the patient's problems by gathering information about the client's current issues, history, and goals for therapy. This helps in creating a tailored treatment plan. During the assessment, the therapist may ask about specific thoughts, feelings, and behaviors that are causing distress, as well as any coping strategies the client has used in the past. Thereafter, the patient and therapist agree on a set of goals and plan of action to achieve these goals. Both forms of CBT, Ellis's and Beck's, aim to identify the negative and irrational thoughts, however their approaches are slightly different. Ellis's Rational Emotive Behavior Therapy, REBT. Ellis's Rational Emotive Behavior Therapy, REBT, introduced CBT and extended his ABC model explanation of depression to the AQA model, where D stands for dispute, E stands for effect, reduction of irrational thoughts, and F stands for feelings, produced. The therapist will dispute the patient's irrational beliefs, to replace their irrational beliefs with effective beliefs and attitudes. There are different types of dispute which can be used, including logical dispute, where the therapist questions the logic of a person's thoughts. Self-defeating beliefs do not follow logically from the information available. Empirical disputing, where the therapist seeks evidence for a person's thoughts, as self-defeating beliefs may not be consistent with reality. And pragmatic disputing, where the therapist focuses on the practical consequences and usefulness of holding of self-defeating beliefs. The treatment is usually short and between 16 to 20 sessions, and two of the main techniques often used are challenging irrational thoughts and behavioral activation. Through challenging automatic negative thoughts, patients learn to see the link between how their thinking affects their emotions and to record any emotionally arousing events, or activating events, that may occur. They then think about the negative thoughts associated with this event and encouraged to challenge them with more positive thoughts. They do this by questioning themselves on whether what they think is logical and makes sense, whether it is empirical and has evidence, and whether the thought is pragmatic and helpful. Through this type of thinking, patients are taught to become more objective and replace dysfunctional thoughts with constructive ways of thinking, which should improve their emotional state too. Behavioral activation is based on the idea that being active will lead to more positive rewards that will help alleviate depressive symptoms. Many depressed people become withdrawn and do not engage in previously pleasurable activities, and with the help of the therapist, the patient identifies enjoyable activities and encourages the patient to challenge any negative thoughts they may have in regards to them to help them become active again. Shame-attacking exercises intentionally engage people in behaviors that provoke feelings of shame in a controlled way, allowing people to challenge and change the negative thoughts associated with those feelings. Beck's, 1967, Cognitive Behavior Therapy, CBT. Beck's, 1967, Cognitive Behavior Therapy, CBT, helps the patient to identify their irrational and negative thoughts in relation to themselves, their world and their future, using Beck's negative triad. The therapy is based around the concept of patient as scientist, where the patient takes an active role in understanding and managing their own health and mental well-being. Patients will gather data about their experiences, symptoms, and responses to treatment, much like a scientist would collect and analyze data in an experiment. They will also generate hypotheses to test validity of their irrational thoughts. By adopting this scientific mindset, patients can become more empowered in their treatment process, leading to greater self-awareness and potentially more effective coping strategies. A technique called thought catching is used to help individuals become aware of their automatic thoughts and beliefs. The patient is taught how to identify specific situations, emotions, or reactions, which could trigger negative or unhelpful thoughts. They are then told to record and write these negative thoughts down, usually in a diary. This helps to externalize the thought and makes it easier to examine later. After recording their thoughts, cognitive reconstruction is used, where the negative and irrational thoughts that the patient has identified having are challenged to evaluate their accuracy and rationality, e.g., are they based on facts and evidence. The patient may create a for and against list, which can help them to develop a more objective view of their experiences. These thoughts are then reframed and replaced with more balanced or positive ones. This doesn't mean ignoring the problem but rather viewing it from a different, more constructive perspective. Finally, the patient will reflect on how the new thought affects their feelings and behaviors compared to the original negative thought. The patient may then be set homework tasks related to their identifications, such as tracking their own feelings, practicing skills, or engaging in specific activities, e.g., someone who is anxious in social situations may be set a homework assignment to meet a friend for a drink. Finally, positive thoughts and beliefs are positively and negatively reinforced to encourage the development of healthier cognitive patterns. A patient may be positively reinforced when they receive positive feelings of happiness and pride. A patient may be negative reinforced when they experience a reduction in feelings of anxiety or distress. Cognitive treatments of depression have several strengths and limitations. A strength of cognitive treatments of depression is that they aim to treat the root cause of depression. Unlike drug treatments, which only mask the symptoms of the disorder and are usually only effective as long as the patient continues to take the medication, cognitive treatments are psychological in nature and address the underlying cognitive distortions. Cognitive treatments, therefore, take a more curative and holistic approach, which helps alleviate the symptoms and promotes resilience against future episodes of depression with its expected longer benefits and lower relapse rates, e.g. Evans et al., 2005. This is a strength because it suggests that cognitive treatments can lead to long-lasting change by equipping individuals with the tools to challenge and modify their negative thought patterns. This empowers them to take an active role in their recovery, fostering greater resilience and reducing the likelihood of relapse in the future. A strength of cognitive treatments of depression is that it allows patients to control their own therapy. This can be considered ethical and lead to long-lasting change, as the patient is actively involved and in control of their treatment process. This helps patients to feel empowered, as the only way the patient will improve and the treatment will be effective is if the patient engages with the material and implements changes into their lives. This is a strength because it suggests that cognitive treatments promote patient autonomy and allow patients to foster a sense of ownership over their mental health journey. A strength of cognitive treatments of depression is that they have no side effects. This is particularly important because many traditional pharmacological treatments can lead to unwanted physical and psychological effects, which may discourage patients from continuing their treatment. In contrast, cognitive therapies, such as cognitive behavioral therapy, CBT, focus on changing negative thought patterns and behaviors without the need for medication. This means that patients can engage in their treatment without the fear of experiencing adverse reactions. Moreover, the absence of side effects allows for a more comfortable therapeutic experience, encouraging patients to remain committed to their sessions and apply the techniques learned in their daily lives. This can lead to more sustainable improvements in mental health, as patients can focus on developing coping strategies and resilience without the additional burden of medication-related issues. In addition to this, there are no concerns with possible addiction or dependency with CBT, unlike antidepressants, which would make it more appropriate with patients who have had drug dependency issues in the past. This is a strength because it suggests that cognitive treatments can provide a safe and effective alternative for individuals, particularly those who may be wary of medication due to potential side effects or a history of substance dependency. This can enhance their willingness to engage in therapy and commit to the process of cognitive restructuring and behavioral activation. A strength of cognitive treatments of depression is that there is research to support their effectiveness. March et al., 2007, compared the effectiveness of CBT, antidepressant drugs, and a combination of the two. The researchers examined 327 adolescents with a diagnosis of depression. After 36 weeks, they found that 81% of the antidepressant group and 81% of the CBT group had significantly improved. This is a strength because it suggests that CBT is effective when treating depression. However, March et al., 2007, also found 86% of the CBT and antidepressant group had significantly improved, suggesting that a combination of both psychological and biological treatments may be more effective when treating depression. A strength of cognitive treatments of depression is that there is research to support the effectiveness of behavioral activation as outlined in Ellis-Apkdef model. Babiak et al., 2000, studied 156 depressed patients, and they were split into aerobic exercise, drug treatment, and both. Those in the exercise group had lower relapse rates. This is a strength because it suggests that cognitive treatments can be effective in reducing the risk of relapse in depression, particularly through methods like behavioral activation. A limitation of cognitive treatments of depression is that they are invasive and time-consuming. CBT requires multiple sessions with a trained therapist, which can be incredibly costly, and sometimes this is unaffordable time and cost-wise, making it inappropriate. Drug therapies are cheaper and the patient only has to remember to take the drugs without sharing their intimate feelings of insecurity to a stranger, the therapist, and for this reason, CBT may be inappropriate for patients who are severely withdrawn and already struggling to engage with others. Such patients may feel overwhelmed and disappointed, which may strengthen their depressive symptoms rather than reduce them, making it ineffective and inappropriate in some cases. This is a limitation because it suggests that cognitive treatments may not be suitable for everyone due to the demands they place on the patient. A limitation of cognitive treatments of depression is that the effectiveness relies on the patient and therapist having a good quality relationship. CBT is only effective provided the therapist is well skilled and able to form a positive and collaborative relationship with the patient. Not all therapists will be enthusiastic or as capable as one another, and this may hinder the patient's progress and make CBT ineffective for some patients. Quaiken et al., 2008, concluded in their findings that as much as 15% of the variance in outcome could be attributed to the therapist's level of competency supporting this. This is a limitation because it suggests that the effectiveness of cognitive treatments is not solely dependent on the methods used, but also significantly on the interpersonal dynamics between the patient and therapist. A limitation of cognitive treatments of depression is that it is not an appropriate treatment option for all people. Cognitive treatments require commitment and motivation, which may be a problem for depressed patients, as they may be unable to engage in the hard cognitive work of the treatment or even attend sessions, and many patients will be resistant to change due to the severe irrationality of their beliefs. Alternate treatments, for example antidepressants, which do not require the same level of motivation and may be more effective in these cases. This is a limitation because it suggests that cognitive treatments may not be suitable for everyone, particularly those who lack the motivation or capacity to engage fully in the therapeutic process. A limitation of cognitive treatments of depression is that they are unreliable and difficult to verify. Cognitive treatments rely on patients to self-report their thoughts. This self-reporting can introduce subjectivity and bias, making it challenging to verify the accuracy of the thoughts being reported. Additionally, patients might struggle to recognize or articulate their cognitive distortions, which can hinder the effectiveness of the treatment. This reliance on personal insight can sometimes lead to variability in treatment outcomes, as different individuals may have different levels of self-awareness and willingness to engage with the process. This is a limitation because it suggests that cognitive treatments may suffer from issues of reliability and verification. A limitation of cognitive treatments of depression is that the treatment's effectiveness can be affected by individual differences. Embling, 2002, found that CBT is an effective treatment for depression, but that it is more effective for some personality types than others. For example, individuals high in sociotrophy, e.g. people who strongly desire social acceptance, and with an external locus of control benefit less from CBT than those who are low in sociotrophy and have an internal locus of control. Embling's study also found that CBT and antidepressant drug therapy is more effective than antidepressants alone. This is a limitation because it suggests that the effectiveness of cognitive treatments, particularly CBT, can vary significantly based on individual personality traits and characteristics. Thank you for watching. If you have enjoyed this video, please like and subscribe for more content like this. Bye.